Welcome to Passion for Patients podcast. I'm Tonya Winders, the president and CEO of GAAPP, and I'm excited to welcome you to this conversation around food allergies update in 2025. I'm joined today by Dr. Karen Rance, our Chief Medical Officer. Welcome back.
Thank you so much. It's a pleasure.
Yeah, thanks for being here. 2025 has been an eventful year.
Yes.
We're coming into the latter part of the year with this episode of the podcast and really want to think about food allergies.
Okay.
What we've seen changing over the last few years and maybe what's on the horizon. So why don't we just jump right in? So Karen, share with us what some of the latest updates and changes are in food allergy.
That's a great question and a really important place to start. So we are seeing more widespread component resolved diagnostics. So those help identify specific proteins that the individual may be allergic to. Now, the benefit of that diagnostic approach, what we theorize in the future, will help further personalize the treatment.
Yeah, so the way I like to explain this is you've got a whole peanut,
right?
And people know that they're allergic to peanuts,
right?
But the components tell you which part of the peanut, right?
That's right.
Because we know that certain parts of the peanut are more allergenic and therefore cause more incidents of anaphylaxis or life-threatening reaction.
That's right.
Versus just like minor reaction.
Right.
So knowing which component, which piece of the peanut is the most important really does have significant implications on the risk of reaction.
Right. Exactly. I think another advancement that we've seen is with oral immunotherapy.
Yeah.
Certainly in the developmental pipeline, there are sublingual tablets that are being investigated. There's also a growing use of sublingual drops that are not approved in the United States. They are used off-label in other areas of the country. They have regulatory approval, but and in addition to that, we are seeing the entrance of the biologics really into the food allergy space.
So omalizumab,
That's
the
right.
first one approved.
That's right.
For use in food allergy in the U.S.
That's right.
And working now in the U.S. and also on the European side of the pond.
Yes.
But I think that that's an interesting space because, again, we know that most immunotherapy in food allergy is happening with what we call home brew, right?
Right.
With whole foods being used to desensitize patients over time. And the addition of omalizumab helps oftentimes to do rush immunotherapy, to do it faster, to get them to a sensitized state sooner, and to reduce the reaction over time and to know what reaction that is, right?
Right.
So thinking about some of the other approaches and knowing that we're moving towards that personalized allergy management, what are some of the preventive strategies that are on the horizon or that we're actually advising today?
Yeah, so I think and that's a big shift also from just treatment to prevention. So the early introduction of foods is there's a key emphasis on that, and that's really introducing the foods to a 4 to 6 month old infant, much earlier than perhaps we did, a decade and a half ago. And that's really based on additional research. Now, and that's particularly important when there's high risk infants, right? So if the infant has eczema or the infant maybe there's a strong family history.
Yes.
But, one thing I would be remiss is when we were speaking before, as far as updates, is really the transcutaneous immunotherapy, which is
so what does that word mean? That's a big word that most people don't use. So break it down, Karen.
There you go. So it's a skin patch,
right?
So much like, immunotherapy is working to desensitize, as you articulated, that there's in the pipeline, hopefully soon to cross the finish line, a product that would be available as a skin patch. So I think that's an exciting advancement.
Yeah. So that, again, patch that delivers the peanut protein to desensitize you rather than having to ingest it or swallow it,
Right.
ingest it
Right.
we're doing today.
Yes, exactly.
So then thinking about early introduction, again, when my kids were little, we were told don't introduce any high allergy fruit foods, for the first year. Now we've changed that, and we're certainly saying that it's preventative to begin to introduce those foods just like you would in a normal diet, whatever your family is eating,
That's
to
right.
introduce that to your child. But how do we know a food allergy versus an intolerance, especially in kids who maybe can't communicate exactly the
Right,
symptoms?
right. So the symptoms, certainly the food allergy can be life-threatening.
Yes.
And so often manifest as perhaps hives, shortness of breath, the child may vomit, something, more of a systemic. The food intolerance is more of a, maybe a diarrhea. You don't see the acute reaction. And it's very important to understand, the difference, of the two.
Yeah.
And typically that can be discerned, in a diagnostic pathway,
Yeah.
when working with their doctor. But, one thing I will go back to that early introduction, I think it's also important to explain is, when we withhold, and this is a mistake, I mean, the entire population made, right? Because it was our understanding at the time, if you go back 25 years, when you withhold a food or in this case, a food, from a child or from anyone, then when they eat it or when they encounter it, the body may see it as foreign.
Yes.
Right. And so it has this allergic response. So the concept behind the early introduction is really, little bit by little bit that their immune system can, learn that, okay, this is food, this is okay.
Yes.
And then it also allows that, if there are any issues, that, we can, readily, observe them and diagnose that.
I always say about that conversation of early introduction, that we know better, we do better, right?
That's right.
As the science has evolved, we definitely know that it is better to introduce foods in the first year of life as we would in our normal diets.
Right.
And to help the children's system basically recognize it as a friendly food instead of as an enemy.
That's right.
And so I think that that's really important to talk about. So thinking about where we are globally in patient care and food allergy in 2025, what are some of the trends and things that you see that our audience should be aware of?
Well, I think that the challenges, I can start with a few challenges. Access to accurate food labeling continues to be paramount.
Yeah.
And we at GAAPP are focused on this, and certainly as we go into 2026, how can we affect change for that? So, that lends itself to, even eating in restaurants, right? So that can be challenging. We are seeing there's some apps that are being developed that, how to find a restaurant that is allergy friendly, how to, communicate to the restaurant, and try to avoid an issue of cross-contamination for sure. And so, in parts of the world, there's also still concerns about access to allergy specialists.
Yes.
Right. So, the challenge is, how do I get diagnosed? How do I determine, if it is intolerance versus allergy? How do I figure this out for my child? So, we at GAAPP are also working on available resources that can help guide in those types of situations.
Yeah, that workforce development of the allergy specialty is something that, again, as I travel throughout the world, is so interesting to see. In some countries, there are no allergists or allergologists, as they are called. And in some countries, it's very prominent, and there are many allergist. So it's easy to access. But food allergies specifically is so complex that it truly does need that board certified training in food allergy specifically, and to be managed well for most if it's life threatening. So let's talk about food allergies a little bit more and think about, one of the myths that we often hear is I can outgrow my food allergy, or this child might outgrow, or did they outgrow? How do you go about that when you're talking with patients?
Well, I refer to the data, and what we look at prevalence data as far as outgrowing, there is a likelihood that specifically with egg, wheat, milk, soy, that those allergies may be outgrown.
Yes.
Now, those four in particular are part of the most common 8.
Yes.
Now, the other 4 allergens in that common 8, which are peanut, tree nuts, fish, and shellfish, are not as apt to be outgrown.
Right.
So it is important to understand that probability. And to be honest, the treatment isn't necessarily, or the treatment approach, from the individual needs to be cautious, regardless of where they think this allergen food allergy may be in 10 years. But that's why it's important to, have that relationship with a specialist who can really guide them through those years, that journey of working with their allergy.
But I think in 2025, one of the things that I'm excited about is it used to be that it truly was, if you had a food allergy, like my youngest, Carson did, it was avoid that food and carry epinephrine. And that's all we could really say, right? That was the 2 treatment strategies. And so sometimes that was limiting. We didn't go certain places, we didn't do certain things.
Right.
But 2025, it's quite different. There are treatment options, there are more on the horizon. And we really don't say restrict your travel or eating out or anything like that. So is it safe to travel and to eat all across the world with food allergies in 2025?
Yes, with awareness and some healthy caution.
Yeah.
Absolutely. Again, I'm always trying to advocate for my patients to self-aware and not put any limitations on their lives.
Yeah.
So I think, yes, you can travel, the airlines, there's a varying degree, but they are aware of it, and you can call ahead and talk specifically. There's meals to order and the like. When traveling to new places, you can talk to them about the foods, etc. And try to
Some
understand.
countries do a great job of listing every single one of the top 9 allergens on their menu.
That's right.
I love it when I travel. For example, like in Italy, oftentimes they're very, very detailed with their menus.
Yeah.
And so I think that there are best practices actually that we could learn from across the globe.
And I think it's also, if you are traveling to a country that's not your native language, to have a translation card, on what is the emergency, what is your medical ID, what is your allergen, so that in just a blink of an eye, you can communicate that. And as you mentioned, that you had to do with your son, but it's still the absolute essential is to carry 2 doses of epinephrine.
Yeah.
And so now we have one of the new issues in new things we have in 2025 is we have the availability of there's a nasal spray epinephrine on the market, as well as
so no more injections.
That's right.
All.
That's right.
That's welcome news.
Yes, so they do have a choice, but whether it's the nasal spray or the injector, the self-administered injector, to have at least 2 doses. And if you have a propensity to to have an allergic reaction, take 6. Talk to your doctor about that you'll be gone for a certain amount of weeks, and you just don't want to run out.
Yeah, it's so important to always have access to epinephrine.
Yes.
So thinking about globally and the differences that we see around food allergy in different regions of the world, has that been surprising to you in the time that you've been with GAAPP?
Yes, it is. There's because of the different cooking methods,
Yes.
right? Peanuts, which we've talked about, roasting peanuts actually increases their allergenicity, which means
Yes.
their propensity, the tendency for them to provoke an allergic reaction.
Yeah.
Parts of the world, certainly Asia, that it's the boil their peanuts, right? It's more of a tradition to boil their peanuts, so we don't see that. So I do see that as far as differences. The availability of these newer treatments, which we had alluded to with some of the peanut and the emerging or the biologic that's approved, omalizumab.
Yeah.
I see a difference, in that as well.
Yeah.
But I must say, in a good way, that we are seeing more recognition. It's more of a discussion than perhaps it has been,
Yeah.
in years past, as far as it's not just a something that affects the Western, world.
Right, right. And I think that that's the thing. Although it looks a bit differently in different regions throughout the world, we are seeing prevalence really globally continue
Absolutely.
to rise. And maybe we're just doing a better job of recognizing it
Right.
and diagnosing it, but it's very true. So, if you had just three tips
Yeah.
for people living with food allergies,
Yeah.
what would they be in 2025?
Well, one is to read the labels.
Yeah.
And it's very important. Even the small part of, it may contain, and
Yes.
just assume it contains, right?
Yes.
Gravitate towards areas or places that they do, that they really do a great job listing,
Yes.
all of those. So communicate your allergy clearly, I think is very important. um, one tip is if you have a card that you can give it to the waiter, so then the waiter can take it, back to the kitchen and show the chef exactly
Right.
what, you're working with. I think that also there's a lot of apps that are coming out, which we had alluded to some earlier about finding the restaurants, but even keeping track of the allergens and how to communicate that is a great idea. And then I would say the third one is always to keep the 2 doses of epinephrine.
Yeah. Keep Epi close.
Keep
Yeah.
epi close,
Just in the
absolutely.
event. Again, hopefully it's the best life insurance that you never have to
That you
use,
never have to
right?
use. That's
So
right.
that's what we call Epi. Now, I want to shift for just a minute around the whole person living with food
That's right.
allergies, because so many times we hear a level of anxiety and fear in individuals with food allergies that really isn't as prominent in a lot of the other conditions that we work in and
Yeah.
GAAPP. So how do you go about having that conversation with patients?
Yeah, and it's very real, the fear. And the reason is, think about it, is we can't avoid eating.
We have to eat at
We
least two or
have
three times a day.
we have to eat.
Yeah.
And it's so hard, especially when it comes to children and adolescents. Not that it's easier for adults, but it's even more so for them, I think, to live life, develop, normally. So and to have those social interactions. So I think it is very important to acknowledge that the fear can be there, but more importantly is, how can we empower those patients,
Yes.
right? How can we teach them to overcome? There are many great resources of our member organizations here at GAAPP, and they have a variety of, perhaps they have camps for the adolescents, but maybe they have handouts or other ideas. And so but left unchecked or left unaddressed, that fear could really bring about distraught, and really feeling down
It can be worse than
and
the
depressed.
allergy itself.
Exactly.
Yeah.
Exactly.
Yeah. So get
Exactly.
the help you need is what I hear you
Get the
say.
help. Yes, get the help you need. And the mental health aspect of this is so profound, more so than almost any other
Diseases.
condition.
Yeah, yeah.
Yeah.
So let's turn to the future. And again, take out your crystal ball. Tell us, if you had to look into the next few years in food allergy, what do you see on the forefront?
Well, when you look at the research pipeline, there's ongoing efforts to combine two different food proteins into one treatment modality.
Yep.
So we will, that's pretty early still, but nonetheless, moving forward, the skin patch that we talked about
Yeah.
for peanut, we hope that that crosses the finish line.
Yeah.
And, and so that would be available. I think we're going to see
peanut first, but milk and others coming
Yes.
after. So,
Yes,
yeah.
yes, which is very exciting.
Yep.
I think we're also going to see AI into this space with for a good way, right? So to help with the different apps, the different help increasing awareness. When, for example, when a child maybe goes to school, there might be, it would just be one step easier to communicate, to the school or the teacher, et cetera. So really leveraging, the availability of the technology to I guess almost improve community acceptance. So it's not so that the individuals with the food allergies don't feel ostracized.
Yeah, I think that's so important. Leveraging technology in order to communicate more effectively, to have a personalized food allergy plan, management plan, to know what ingredients are in what prepackaged foods, for example. All of these are new technological advances that I think we're going to see great
And let me add one other thing that I'm particularly interested in that I see is the research on probiotics.
Oh, yeah.
To really help the gut be as healthy as possible. And there's some great research ongoing about that. And the premise behind that is that if our gut flora is healthy, then the provoking trigger maybe minimal, maybe non-existent. We're waiting to see what that is. So that's something else we'll have to watch out for the horizon.
Yeah, I think that's an important topic because, again, the jury is still a little out on the benefit of probiotics and prebiotics and how it interplays with food allergy. But we know that, again, overall health is so important.
That's right.
And so many of these people with food allergies are living with multiple different conditions. And so managing them all effectively is so important.
That's right.
So, Karen, any last words before we close out this podcast? Because I think we covered a lot of ground.
Yeah.
And the future is bright in food allergy.
Well, I think my message I'd like to leave everyone with is food allergies, though they may be severe, they're manageable.
Yes.
And know your rights, know what is reasonable to expect.
Yes.
Don't compromise. And most importantly is that these patients, they're not alone, right? And that there are communities, as I mentioned, our member organizations are some of the best in the world as far as communities, and GAAPP will continue developing resources that can be shared through those organizations. But don't give up.
Yeah. Well, again, thank you all for tuning in. Thank you for, again, the update in food allergy, all the advancements. It's such an exciting time for the millions of people across the globe that are impacted by life-threatening food allergies. And we know that there is so much more that is on the horizon and to come. And until that time, until we find the cure for food allergy, until we can manage every patient effectively, we hope that you, as passionate patient advocates, will stay passionate and stay engaged.